Okay, so this is my Module 6 assignment, the SBAR assignment. I picked scenario number 2, and it is Mrs. S is a 72-year-old retired school teacher. She lives alone with her dog Ginger and is very independent. She was shoveling snow on Monday morning after the large storm. While shoveling, she developed a crushing sensation in her chest. This is not the first time she has had chest pain. Mrs. S has a history of angina. Though she has never had a heart attack, she takes aspirin every day at home and keeps nitroglycerin tabs in her pocket just in case. Mrs. S took a nitroglycerin tab and an aspirin and drove herself to the hospital. Mrs. S was admitted to the hospital on Monday afternoon with chest pain and ruled out myocardial infarction. She has been a patient on cardiology for 4 days now. She has no chest pain since Monday and has been ruled out for a heart attack. She has a IV of 0.9 NS and keep open and expects to go home in the morning. At 2200, Mrs. S put her call light on. Her nurse, Sue, RN, answered the call light. Mrs. S stated that she's having chest pain and rated it a 9 to 10 on the pain scale. Sue, the RN, had the PCA check her vitals and get an EKG. Sue, the RN, went to get a nitroglycerin tab. Mrs. S' blood pressure then was 90/52 and her EKG showed ST changes. Her heart rate was 120 and breathing was labored at 36. And her pulse ox was 85% on room air. Sue gave Mrs. S a nitroglycerin tab sublingually. There was no relief to her chest pain and her blood pressure decreased to 80/52. Sue, the RN, placed Mrs. S on oxygen at 2 liters and her pulse ox improved to 91%. Mrs. X is very anxious and states she feels terrible. Sue, the RN, increased her IV fluids to 100 cc per hour and called the physician. Dr. Wu, my name is Tony. I'm going to discuss about Mrs. S in room C15. Her code status was possible blue. She was in the hospital since Monday and ruled out a heart attack. Today I wanted to discuss possible cardiac arrest. I have assessed the patient myself recently. Blood pressure is 90/52, pulse is 120 beats per minute, respiration is 36 breaths per minute, O2 sat is 85 with room air, temp not taken, and I am concerned with the blood pressure. Initially it was less than 100 at 90/52. Retaking the blood pressure, it is at 80/52, and pulse is staying over 100 beats per minute, and respiration is staying over 20 beats per minute. The background of your patient is Mrs. S is a 72-year-old independent single woman who was admitted 4 days ago when a crushing sensation in her chest while she was shoveling outside. She has a history of chest pain but no heart attack history. When being admitted, Mrs. S spent 4 days with no angina but hit the call light at 2200 hours complaining of chest pain. Blood pressure was 90/52. As precaution, a nitroglycerin tablet was given sublingually. Assessing the patient, patient complains of chest pain rating 9 to 10 and feels anxious and terrible. Her breathing was labored at 85% on room air, so oxygen was placed on her at 2 liters and pulse ox has improved to 91%. Her status seems to be decreasing because after administering nitroglycerin tablets, blood pressure went to 90/52 and then to 80/52. The problem is cardiac and most likely from a heart attack because Mrs. S' most recent EKG is now showing ST changes. Recommendation for the patient: vitals are getting worse after administration of nitroglycerin tablets. I would call for a consult from a cardiac specialist to examine Mrs. S. I recommend ordering a chest x-ray, an ABG test, an EKG, and a CBC blood lab to determine if this is normal range. Also recommend to administer another nitroglycerin tab. If second dose doesn't work, recommend a third dose. When 3 doses are given, she should feel no pain. If she does, there may be another underlying condition, such as a blood clot. This problem will continue until the vitals can be placed on a stable range and chest pain subsides. I will check Mrs. S. vitals after every dose of nitroglycerin tablets throughout this process. I plan to inform family of changes in her vitals, and my plan of action is to manage Mrs. S. chest pain and control her heart attack. For the debriefing part of the assignment, the first question is, what were your thoughts on this clinical scenario? I put my thoughts. I believe it's a great way to learn about the specific scenario that is being presented. It also helped me understand medication and how vital signs work, as well as how to speak with a physician about their patient. Also, it forced me to look up terms that I didn't know or understand. Let's see. Second question, what do you think could be added? I think what could be added is how to speak with the family and how to go about that, and how to update them on what to say and do. One thing that was, it is, what do you think we do not need in the SBAR? I think everything in the SBAR was necessary to inform the physician and to update them on the patient's care constantly. Overall, everything in the SBAR was helpful to solve the scenario. Some information that can be taken out are information or stuff that nurses do that don't need approval by the physicians. And also, like, addressing the patient's vitals and pushing fluids. And then next question is, if we did this conversation again, what should we do differently? I believe the information that SBAR could have been laid out in an understanding way, and repetitive information in the SBAR could have been taken out to give more of a clear understanding. There was some information such as what medication the patient was on for her chest pain recently would have been helpful to know when treating her in the hospital the first time. Question is, what do you think the significance of the situation was clearly presented to the physician? The significance of the situation was patient having a heart attack and she may go into cardiac arrest. It was important to act fast, which when vital signs were beginning to decrease after giving that nitroglycerin tablet. It's also important that we find the normal range for the patient. That is why I recommended running tests on her to see the normal range, and she should be referred to a cardiac specialist to further treat her. Overall, the physician should be updated to ensure no more drastic measures should be taken. In conclusion, SBARs are very helpful for nurses, very informative, and give nurses a way to organize important info about a case and a patient. It is important we are contacting the physician with all the information so they fully understand the case and what is happening with their patient. And lastly, it is important to remove unnecessary information so there is no confusion when presenting yourself to the physician. SBAR reports are vital when communicating with all physicians. Many physicians have different patients and cannot keep track of all the minor details for all the patients, so SBARs are helpful for nurses and physicians.